I'd say as far as the organization of the program, we try to make it as seamless and predictable for residents as possible, just so they have a really smooth experience. Dr. Walker, our program director, is very on top of all the scheduling and organizing things and tries to anticipate any issues with any of that. Also, our program coordinator, Rhonda Wallace, is her right-hand woman and is highly involved in checking in with the residents and making sure everything's going okay, and also anticipating our needs. So I'd say it's a really tightly run ship.
What initially attracted me to this program was location, because I'm from here, but I did a sub-I or a sub-internship my 4th year and worked with Dr. Walker at Tulsa Center for Behavioral Health and really got to experience what it's like at this program and had a really good experience. The residents I worked with seemed very, very happy. Attendings all seemed very supportive. So I knew that this was going to be my first choice and where I wanted to go.
During the course of their training, our residents get to rotate at many different community sites, which is great because we're a school of community medicine. So we're at several different hospitals and several different clinics for our different rotations, including an intensive outpatient programs, child and adolescent partial hospitalization program, multiple inpatient units, multiple different hospitals for different rotations around town, as well as our Schusterman Clinic for their outpatient care. During the 2nd and 3rd years, we have a somewhat unique schedule for our outpatient and other rotations. So instead of having 12 months in a row of all outpatient clinic, our residents rotate half outpatient and half of another rotation, whether that's geriatrics or child and adolescent or inpatient or consults, every month during the 24 months of the 2nd and 3rd years of training. And then in the final year of training, most residents have 8 to 10 elective months where they can customize what they're doing to suit their individual interests and educational needs.
Program is structured, it depends on what year you're in, right? So intern year, there's time doing family medicine, neurology, and then inpatient psychiatry. Your 2nd and 3rd year, you kind of alternate between the clinic environment and the hospital environment. And then your 4th year, there's a lot of elective time, and then you're also working with the new interns that are coming in and showing them the ropes and how to go about doing things and being a support for them. We have didactics on Wednesdays, and so that's protected time that we can learn and not have to worry about that being interrupted. I would say that the best part of our program is the people. That includes the attendings and the other residents. I feel like we all get along together really, really well. I can go to my attendings about things that, I may not be super comfortable with, and they're always supportive. Likewise with the residents, I feel like we mesh really well together, and it makes for an enjoyable experience for residency.
Some of the things that I think are unique about our program are that we are located in a mid-sized city. So we have all of the amenities of a good-sized city that still has a small town feel, where you can get around town easily, see people that you know anytime that you go out. Also, for being a relatively small program in a city of this size, we have a family-oriented atmosphere to our program and our department, but we still have access to a lot of things that aren't standard at a program our size. So we have access to ECT, a world-class eating disorders program, world-class research, as well as our assertive community treatment team, our impact team, which is really kind of the jewel of community medicine, where we're actually going out to people's homes or seeing them on the streets or in the shelters and bringing medicine to them to really care for our community.
I really love living in Tulsa, mainly because there's a lot to do here. It's still small, but it's also big enough, lots of good food, and lots of things to do.
I'd say one of the strengths of the program is that it's found a balance between work and time off and balancing, clinical responsibilities with family life and other personal interests. I'd say as far as on-site work, the number of hours is very doable, very sustainable in general over the course of months and years. That's what I've found in my time here. I feel like the more we're able to moderate the number of hours and the workload, the more sustainable it is over a period, the less risk for burnout, and the more people are able to have time and energy to enjoy things they like to do outside of work. Here at the program, we want to foster multidimensional people with various interests and things going on outside of work. So,
the mission of our program is really to train well-trained psychiatrists who are going to go out and practice in the community and treat patients. Preferably our community, but it could be other communities as well. And I think that we do a very good job of that in terms of our residents feeling capable upon graduating to go out and practice in any setting, whether that's rural or urban, opening a small private practice on their own, a small group practice, joining a large group practice, practicing in the hospital, in the clinic, in the emergency department, on consults. Our residents really do it all, and I'm very proud of them.